type 1 diabetes is the most common chronic disease of childhood, and it's becoming more common, unfortunately, so it's a major burden. So at the moment, all we can do with children with type 1 diabetes is replace insulin, and we're getting better at doing that. But we do know that if you can preserve the function of the cells, or allow them to keep making insulin for a longer period of time, it's easier to control the condition, and the risk of developing long-term side effects is reduced. So, the ultimate goal is to try and preserve the cells that make insulin.
My speciality is immunology, and particularly understanding autoimmunity, which means diseases like type 1 diabetes, where the immune system mistakes self for being something it needs to attack. And we've spent many years understanding that and working on ways in which we can intervene in that process in a similar way to vaccination, so something that would be safe, preventative, and would really change the outcome of the immune system in a disease.
I'm hoping that one day when a child is diagnosed with type 1 diabetes, we'll be able to offer them a particular intervention which would suit their particular characteristics. And then if you go even further from that step, identifying, as Ranjeny said, those that are at very high risk of developing type 1 diabetes, and actually starting some intervention which will prevent them getting diabetes. The main attraction for me is that this treatment is very specific. It has the potential just to affect the immune cells that are attacking the insulin-producing cells. So previously people have tried more general approaches where they suppress the whole immune system, and obviously in children there's a risk of infections if you do that. Whereas this approach will just be very targeted, so I think it's a great advance.